Hello there. Welcome to the sort of overview of the Masters in Health Services Management. Thanks very much for listening in. So my name is Sue Campbell, and I am the programme lead for this new programme, actually, that's starting in September 2024. I am also the programme lead for the on-campus Masters in Health Services Management, which has been running since 2019. Okay, so just going to do, I've got some slides I've prepared. I'll just run through them, and then if there's any questions, please do feel free to ask, and I'll try my best to answer them. And if I can't, I can come back to them later. So just, a big welcome to the University of Glasgow. A bit of background to where we're at. So we have 43,000 students from more than 140 countries that have studied with us. And we are ranked in the UK's top 20 for the graduate employability from the 2022 rankings. The university has more than 300 student clubs and societies, so this is a wonderful community, both online and on campus, and also for our undergraduates and other programmes, we have study abroad opportunities in more than 200 destinations. So we've got a great partnership globally for lots of different programmes. So you might be thinking, well, why would I study health services management at the University of Glasgow? I mean, I think some of the important things to note about this is that, well, we do deliver this in conjunction with the Adam Smith Business School. So as well as having that health services aspect and management, we also do have that business and management from a well-established institution. We explore the management and leadership skills required for contemporary health service organisations, and we also encourage a very critical approach to your learning. I mean, you'll all be fully aware of things like the COVID pandemic and how health services, had to sort of step up and change the way they do things dramatically, use different management and leadership skills. So I think what we can say about health service management is that, there isn't one way to do it. We have to be able to be critical. We have to be able to be reflective. We have to, be able to sort of use all the tools that we possibly can in order to address some of these sort of contemporary issues, if you like, in management and leadership in health services management. A little bit about the structure of the Masters in Health Service Management online programme. So in keeping with all kind of Masters programmes in the UK, a Masters programme is made up of 180 credits. The Health Service Management programme we have has what we call 60 credits as core. So that means these are the compulsory modules that you must do as part of the programme. And that's made up of 3 10-credit modules from the business school, an introduction or fundamental course on health service management, and a research module, which is 20 credits. And you'll find that in the UK, that in master's programmes, that they'll all have really essentially a sort of 20-credit research module to allow you to develop the skills necessary to be able to go on and do your dissertation or project. So we have these core 60 credits, and then we have another 60 credits that you can choose what topic you would like to study. And I'll show on the next slide some examples of what they might be. So what we've got here is we've got 3 20-credit modules, and from a longer list, and you basically pick 3 of them. That gives you what is called 120 credits of top modules. And then the final part of the master's programme is 60 credits for the dissertation. So this is a longer piece of sort of self-directed work. And you've got a slightly longer time in order to be able to develop that. And you'll work with a supervisor who will support you through that process. For the online programme, all content will be accessible online. Most of it will be very what we call asynchronous, so you'll be able to pick it up in a time that suits you. So if you're in a different time zone, for example, you can work on it in your evenings, and there'll be very, very little, if any, sort of fixed times where you have to be online at any point, and any sort of recordings or webinars will be recorded anyway and available for you afterwards. So that's a kind of standard structure of what a master's program looks like. As I say, we have the 60 credits, which are core modules, and then we have 60 credits that you would choose which optional courses you would like to do. So each of these courses listed here are worth 20 credits. So you might decide that you want to have a little bit of a focus on health professionals education, as it might even be something that you haven't particularly thought about doing, but you would like to just gain a bit of knowledge on it. Then that would be one of your options that you could do. You might be interested in health promotion, or you might be interested in globalization, or we have other modules on things like planetary health. So thinking about these sort of wider determinants that influence health and well-being. So that's just a sample of some of the options that you would be able to choose. We tend to run modules over 3 semesters. So the start for our program is September. So we'll start in September 24. You would be working on 20 credits from September to December. You can do another 20 credits from January to March, April, and then another 20 credits from April to July. With the online program, there are options to take a break here and there. So if you were doing a full master's program, you would have 6 years in order to complete your 180 credits. If you wanted to do a postgraduate diploma, you would be doing the 120 top credits, but you wouldn't go on and do the 60 credits dissertation, and you would have 4 years in order to complete that. If you were interested in a postgrad certificate in health service management, then you'd be looking at doing 60 credits. And again, you would have 4 years in order to complete those 60 credits. So if you have, other life events going on, or maybe, a promotion at work, or whatever it is you have, and you wanted to take a break over one of the semesters or a couple of semesters, that's perfectly possible with the online program. Just to note that each of these modules will run in a specific semester. So you can't, if it's scheduled to run in semester 2, you would either have to do it semester 2 of your first year, second year, third year, fourth year, etc. But there is quite a bit of flexibility about how quickly you work through the program. So why do health service management? Well, some of the the themes behind this program are that we want you to have a thorough knowledge and understanding of evidence-based practice. We want you to have a critical appreciation of the relevant theoretical, methodological, and technical literature. And we want you to be able to apply this in sort of, as you develop management responsibilities and practices. And that's something you get to test out in during your dissertation or your project. And as I mentioned earlier, the whole idea about this critical appreciation is that you can't study and learn everything that you can then just pull out a toolkit and be able to have one size that fits all when it comes to health service management. So what we want you to be able to do is to be very critical in your approach. So to think about, okay, in this situation, I want to use this approach to leadership or to management. In another situation, I might use a completely different approach to leadership or management. If something was a critical emergency, that would take a different leadership style to something that was a bit of a more long-term development sort of management intervention. So we want you to be able to know that what's appropriate when. And as I say, with recent events and with the pandemic, etc., we really do have to be able to take this sort of critical approach to how we do leadership and management. In terms of future career, there's it is a very broad sort of topic, and we have certainly on our on-campus program, we have students from all different professional backgrounds. We have pharmacists, we have doctors, we have nurses, we have physiotherapists, we have people from a more business administration side or hospital administration background. We have people working for governance, working in private sector, etc. So there is a very broad cohort of students, and actually I think that's one of the strengths of the programme, because it's all about working in multidisciplinary teams in healthcare. It's about understanding other professions and working together, and with the same kind of aims and objectives. So on completion of the master's programme, some students work in health service management, work in social care, at all different levels, whether combining with a clinical area or whether coming this through a sort of administration and business background. Some work in large hospital organisations, some work in the private health sector or the pharmaceutical industry. Some students have been working in charitable organisations, a sort of third sector or NGO environment, and some have worked for some of the sort of policy think tanks, including working for some of the sort of royal colleges and things like that. So to be able to sort of influence policy and that type of thing as well. In terms of the learning and how we go about the teaching, there's a sort of a variety of ways that you're being assessed and ways that you are being taught. One thing I would say that can be different from other countries is that we don't have a very big focus on exams. Okay, so it would be unusual and highly unlikely that you would have things like a written exam, a sort of timed assessment, that type of thing. So a lot more focus on things like essays, reports, group work, individual presentations, designing posters, that type of thing as a form of assessment. So each of these modules that you undertake will have its own assessment. At the end of the programme, there isn't one overall exam that looks at everything that you've done. So you're assessed as you go along on each module. And most modules you'll find will probably have 2 assessment components. In terms of approaches to teaching, we have online materials that, as I say, you can access them asynchronously, so you can sort of log in and look at the next section that you want to look at. We have online discussion forums, so as you work through these online materials, you might be asked to reflect on something or to share some experience on something. So then we might use Microsoft Teams or sort of class space and things like that, where you would discuss things with your peers on that module. We can have extra sessions, like journal clubs, so reviewing leadership and management literature and discussing that. We can review each other's work, so peer review, and the focus as well on reflective practice. And I think that's one of the quite nice things about being an online student, is that, for most people, they are currently working, so they're juggling their studies with their current job. But that gives you lots of opportunity to reflect on your practice and think about, okay, based on your new learning, would you do things differently in practice, or how would you interpret what happens in practice? So that's I think that's one of the benefits of being an online student, that it keeps it all very real and tangible as well. So just, of course, if you have any questions after the session, you're more than welcome to contact either myself or Barry as the programme administrator. My background is that I'm a nurse by background, and I worked in global health for about 20 years. So I worked in different parts of Africa as a country director and medical coordinator, working for the international NGO sector. And I've been at Glasgow University since the Health Service Management programme started. So that's kind of a little bit of background to me. Hello, Karen.
Hello.
How are you?
I'm fine, thank you.
Yeah, sorry, I was just bashing through a talk there. But no problem. You're very, very welcome to join us. So just what I'll do is I can flick back just to, yeah. I obviously don't want to put you on the spot. Did you have any particular questions?
I was really just to kind of learn a bit about the course. I'm really keen to start my masters. I've done some like master modules, but I've not got a full masters. And I'm now in a manager's role in the NHS. So this is why I was really interested on this one. And the fact that it's online, I could do it while working.
Right.
So it was just to learn a bit about it to see.
Yeah, no. Have you got a good idea of what a master's kind of looks like in terms of 180 credits and all the rest of it? Yeah. So what we have is 60 core credits, 3 from the business school, which is 30 credits, and then the rest from the kind of medical school. And then another 60 credits, which are, there's a sort of range of optional modules. So that would be 3 20-credit modules. Have you done the micro-credential?
I've done 2 of them. I did the change management and I did the leadership in healthcare one, I think it was called.
Yeah. So I was a program lead for the leadership management, introduction to management and leadership in health services, which means that certainly that 10 credit means that you're not required to do 10 credits of this one. The change management, I would actually quite like to check. I'll give that as a task for Barry to see if you could possibly be exempt, because we do have a change management core module. You're halfway there. No. So let's say definitely 10 credits you wouldn't need to do. So you're left with doing 110 credits of top modules,
Right.
And then 60 credits for your dissertation. Yeah. Yeah, so this is the first time this has been running online. So we've had it on campus since 2019. We'll be starting the online one in September.
Right.
And I mean, what's quite nice is we pick a few modules from sort of all over the university. So, you know, we have modules that are part of the public health masters, as well as modules that are part of sort of more broadly medical. We have the teaching and health professionals, which is part of the health professional education masters. So you can kind of dip in and, you know, try some different things. You might find that you've got, okay, that I want to do a couple of modules which are absolutely core to management and leadership. I want to do leading improvement in care provision, for example. But I have a bit of an interest in globalization or teaching health professionals. And, you know, so I might just do that because I'm interested, you know. So there's a bit of flexibility. You do, I mean, this is recorded, so you can obviously listen to it later, but you've got 6 years as an online student to complete your masters. So if life kind of gets in the way, you know, and you really think, okay, this semester I just cannot do it, then you can, you know, opt out and then come back, you know. So so that's quite, I think that's quite good, because life does get in the way despite your best intentions, you know. You've got a busy job and all the rest of it. So that, I think that's quite nice with the online, and it will be all online.
Yeah, that was a big appeal for myself because it is a full-time job I've got with 3 kids. So the online element really is a really good selling point.
No, that's it. When you drop them at their swimming lessons, you just sit there in the car on your phone trying to catch up on your material. Yeah, it's all there.
That's also a good point to say our materials are fully accessible on all devices, so you can watch them when you're in the car, obviously not driving, but if you're on public transport, if you're waiting around, you can access the material and catch up wherever you are. So that is one of the big benefits of our online programs. The material is all asynchronous, so everything is online actually on that. So is there any guest lecturers or speakers or any live events that are happening throughout the year?
No, I mean what you do have access to is obviously all the wider university things. So if the business school is putting on a live event, or even although might not be a on-campus student, you can still access those events, and some of them are online, so talks and things like that. So but we do try and make it as asynchronous as possible so that there is that complete flexibility. Deadlines for assessments are fixed, but otherwise procrastination sets in.
Definitely.
Yeah, so you need those deadlines, but really everything is asynchronous. And if it wasn't, it would be recorded.
That's good.
Yeah. Yeah.
We have a student question that's been asked: can students attend graduation?
Yes, be delighted.
It's a great opportunity for students to come along, see
No.
the campus, even if they're not local to Scotland or Glasgow. We do have students that fly over for their graduation and take part in their ceremonies. It's a lovely way to end your hard work and dedication and get to see the beautiful campus that we have. And hopefully the sun will be shining on graduation days.
I do think that's nice actually, because I think that, we have such busy lives nowadays. Sometimes it's just really nice at graduation to just say, like, stop and reflect and think, oh my goodness, I have achieved so much, rather than thinking, okay, what's next? What's next? But actually to take that time and say, okay, I made it, yeah, and celebrate with family and and other peers and things. Yeah, yeah, no problem. More than welcome.
How many modules, sorry, do students take at the one time?
So what you're aiming for, and cause you've got that flexibility with the 6 years, what you're aiming for is 20 credits. So 20 credits translates as 200 notional hours, if you like. So that's the reading the materials and digesting and reflecting and putting a message in a discussion forum and preparing for assessments and any wider reading that you want to do around the topic. So you're looking at 200 hours a semester. And in a lot of ways, most of our modules are 20 credits. It's only some of the kind of business school ones and the fundamentals one that are 10. So there is a possibility in the beginning to do 10 credits, for example. So you're looking at 100 hours over the kind of 10 weeks or semester, and do it that way. So roughly, yeah, about 200 hours a semester, 20 credits. I wouldn't do more than that as a part-time student.
Is there any group coursework on any of the assessments, or are they all individual based?
I would expect that there will be perhaps maybe 1 or 2 group works. It won't be a big part of it. Just because people are in different time zones, etc., etc. But there might be 1 or 2. So, for example, if you take one module and the assessment is 100%, obviously, per module, you might find that there is the odd 20% that might be a group work and 80% will be your own individual work. So it would never be a huge part of it. But I mean, I can't kind of speak for all the modules because I don't run them all. But certainly for the ones that I'm more familiar with, most of it is just individual. Yeah.
That's great. Are they able to connect with each other online? Are there any platforms that we have available for students?
Yeah, so we use quite a lot of Teamspace, Microsoft Teams, and there's a little sort of classroom. And what tends to happen, certainly on the modules that I'm leading on is that there's a sort of maybe 3 or 4 questions each week on that particular week's topic, and then the students can put in their responses and they can see each other's responses, and it's a great way to it's a great way to learn, because when you're sort of putting something in a public space, you're writing a response, it does really encourage you, I think, to think about what you're writing, and then there's that opportunity to learn from other people as well, to see what other people have written, and you know, maybe they're from a completely different health system, for example, and just, you know, share ideas and different ways of doing things. So there is a really nice bit of sort of peer-to-peer learning, if you like, which I think is useful. Yeah.
When are the course reading lists available?
Oh, from day one. Yeah, so there's a link on each what we call Moodle, which is the platform where a lot of the courses sit. The library reading list is available, and you can just click right through to the library and access the resources, which is very nice. Yeah, when the links work.
Definitely. And if you are local and you do want to come visit on campus, our library is huge. It has millions of books inside it, and it has 12 floors. So it is a great facility. If students do want to come on campus, they will need to get their student ID card, which they can contact us about, and this will be posted out to them, and they'll be able to use this card to access the buildings and facilities on campus.
Yeah, no, it's good. It's good. But I mean, one of the challenges in studying nowadays is, particularly if you haven't studied for a while, is just the wealth of resources that are online. There's so much to read. So I mean, I guess that's one of the skills you learn is how to manage that information, because there is so much, and so much online as well. A lot of books became like ebooks during the pandemic as well. So yeah, huge resource from the library. Yeah.
Yes. If there's any questions, or anybody watching the webinar recording, if you have any questions about admissions or your application, please do get in touch. There is an admissions inquiry form online that you can send across straight to admissions, and they'll be able to respond to you. The application processing time is around 21 days, so you should receive your offer or your notice in that time frame. If you do not, please log in to the applicant self-service portal. Again, it's accessible online, just using the login details that you used when you submitted your application. If you log into this, you'll be able to see the status of your application. Now, sometimes it will be put on hold if all documents haven't been supplied at the time of application, and you'll be able to see which documents we're waiting on to complete your application. So again, any questions about this, please just reach out to us. There's a contact email address on our webpage, and also the admissions inquiry form. So hopefully that will clear any admissions queries if we have any come through. We haven't got any more that are in at this point. Karen, this will be available, so you can watch the recording back as well afterwards, and you can see the programme in more detail. But if you don't have any questions just now, we can wrap up.
Anything?
I asked one question just about fees. So for the module fees, can you pay them per sort of module you do it, or do you have to pay everything in advance, or it was just a bit of information about the fees?
Yes, so you can pay in installments. These are in 20 credit installments. So that is an option. We do have those flexible payment plans. There is also the NHS funded discount. It is on our webpage as well. I'll just drop you a link just now so that you can access this. And you do see the breakdown of what it actually costs with the NHS discount on top of it. So it's quite a nice discount. The fee per credit from the NHS discount is £1,237 currently. So that's almost just over £300 discount per credit. So for the full MSc, it is £11,130 with the NHS discount, as opposed to 15,000.
Oh, that's brilliant. See, with the NHS discount, is that the NHS needs to pay it, or just because you're an employee of the NHS?
Oh, that's a good question. Oh, that's a good question. I would need to look into that. I can take your details from our registration form and send you an email just clarifying
That
if
would be
it
great, just to
is, yeah,
see.
funded or non-funded. Mhm.
Brilliant. That's great. That was kind of my main questions. I think he's kind of covered a lot of the rest there. So
That's the
perfect.
important question.
That's
How much will it cost?
How much is it going to cost?
Yeah.
That's
Anything
great.
else, Karen?
No, that was perfect, dear, because I'd read a bit beforehand about the course and everything. So that was
Right.
just some kind of the bit she answered there. So that's great. Brilliant.
Okay, brilliant. Well, listen, if there's anything, email myself or Barry as well on the kind of more academic, that kind of side of things. Sorry, Barry, were you going to say something?
Yeah, just one question. I know everybody normally asks this is when they proceed to the dissertation, how they choose their dissertation title and how they will be allocated a supervisor.
Yeah, so usually what would happen is that people will work with me at the beginning, sort of brainstorming kind of ideas. We can share ideas with other students, and once so you do choose your own topic. You won't be handed a topic. It's so based on your interest or whatever is, and then you can sort of do a bit of sort of scoping about it. And once you've got a topic that doesn't have to be the final article, if you like, then I would allocate you a supervisor. So you don't have to find your own supervisor. Don't find your own supervisor. Don't need to find your own topic. Sorry, don't get handed a topic. So, there's a whole range of things that you can look at. Yeah, which is quite nice. Yeah. Anything else? All right, lovely. Nice to see you all. Thanks very much for joining us. And yeah, any questions you do just ask. Thanks very much for setting that up, Danielle.
No worries at all. Thank you very much for your time today. It was an excellent webinar.
Oh,
Thank
thank you.
you.
Take care.
See ya.
Thank you. Bye.
Bye. Bye-bye.